between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, and Veterans Health Administration, Office of Patient Care Services. My name is Trulesta Pauling. I'm the Senior Outreach Specialist in CFBNP. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the right of your screen. I will read the questions at the end of the panel discussion, and the presenters will provide a response. The presentation will be made available after the webinar to everyone that registered or joined our webinar today. This is a live recording. I would like to thank Ms. Dana Brunson and Chaplain Robin Booth, Chaplain Constance Arthur, and Chaplain Butler Cole for this collaboration. We are grateful for your time today. But before we get started, I would like to introduce Mr. Conrad Washington, Director of the VA Center for Faith-Based and Neighborhood Partnerships, who will be providing today's welcoming remarks. Mr. Washington retired from the United States Marine Corps with 20 years of active duty service with a combat tour in 2004 in support of Operation Iraqi Freedom II. He is a licensed minister actively serving in his faith. He received his Master's degree of Divinity in Pastoral Studies from Moody Theological Seminary. He also holds a Master's in Business Management and a Bachelor of Science degree in Education. Additionally, he is a graduate of VA's class of 2017 Virtual Aspiring Leaders Program. Mr. Washington?
Thank you, True. I appreciate it. And thank all of you for joining us today. I hope you have better weather than we do here in DC as it's raining. Today's webinar affects a population of people who experience harassment, discrimination, and they have been exposed to forms of violence related to unfair and unjust practices. It's the LGBTQ plus community. They face mental and physical health risks and challenges, along with related long-term outcomes. We all have seen a lot of this in the news over the years, but there are likely more incidents and situations that are never reported. As human beings, we should be able to respect people's decisions to live their lives, just as we should respect people for their choice of faith or no faith at all. For those people who are people of faith on the call and listening, I have a question for you. Shouldn't we be able to extend love to all people, even when you disagree with decisions and lifestyles? For example, in my faith, no man has the authority or power to put another person in heaven or hell, if you believe in that. Now, I'm not trying to spark a theological discussion, but I only want to share that we here at the Center for Faith-Based Neighborhood Partnerships and the VA, we're here to serve all veterans, and that means all veterans. And I'm certain all of you on the call today understand the inclusiveness that the VA stands for. It does not make this agency perfect, because we're not, but we're here to serve all veterans, their families, beneficiaries, and caregivers. Now, we're in a very important month, this month and next month, for many people who are celebrating religious celebrations and reflection. I would ask that you keep in your prayers and thoughts all those affected by the recent collapse of the Francis Scott Key Bridge yesterday in Baltimore. I believe search efforts are still going on. Let's also keep in our prayers and thoughts those victims who are held against their will, and the contingencies in Gaza and Israel, and so many more things that's happening in the world. I want to take a moment and thank Dana for bringing this together, and all the chaplains for being part of the panel today. We appreciate each and every one of you, because I know this is extremely important to this particular group. So thank you all for joining us, and I hope you enjoyed today's webinar.
Thank you, Mr. Washington. At this time, I would like to introduce Ms. Dana Brunson. She is the LGBTQ plus Veterans Care Coordinator Program Manager, who will be providing a 15-minute presentation before the discussion today. Following her presentation will be a 30-minute panel discussion with chaplains from the VA Chaplain Service Office, whom I will introduce shortly. Please read a summary of her bio on the screen. Ms. Brunson, as I mentioned, serves as the LGBTQ plus Veteran Care Coordinator Program Manager for the Veterans Health Administration. She has been with VHA since 2020. Her has served 20 years in the VA. At this time, I give you Ms. Dana Brunson for today's presentation. Ms. Brunson.
Thank you so much, Ms. Pauling, for that introduction. We are all very excited to be here with all of you today to talk about spirituality, religion, and health from an LGBTQ plus perspective. And I just want to begin with a brief overview of the LGBTQ plus health and veteran care coordination program in VA. And so we will start there, and then we will begin to speak with our incredible chaplains. Let's begin with the definition of LGBTQ+. This acronym stands for lesbian, gay, bisexual, transgender, and queer. The plus sign captures identities beyond LGBTQ, for example, two-spirit or asexual or non-binary identities. Language is dynamic and it's constantly changing, so the plus sign also represents future terminology and is inclusive of people who question their sexual orientation or gender identity. LGBTQ plus represents a diverse group of people with minoritized sexual and gender identities, many of whom share experiences of social stigma and victimization and discrimination. So what does this mean for LGBTQ plus people? Gender identity and sexual orientation have an impact on health, just like age, race, ethnicity. Individuals with minority identities often experience poorer health outcomes due to social experiences and lack of resources. You might be wondering about the size of the LGBTQ plus population. In a recent Gallup poll, 7.2% of American adults identified as LGBTQ plus. So we are talking about approximately 24 million people. Now I want to look a little bit more closely at aspects of personal identity we all possess. Everyone has a gender identity. It's our internal sense of ourself. For example, as a man or a woman, or a cisgender or transgender or non-binary person. We also all have a birth sex, which is sometimes confused with gender identity. It's what you see written on a birth certificate, and typically it's based on a newborn's anatomy. It's not always consistent with the person's gender identity as they mature. Gender expression is the way that we present ourselves in the world. It can be speech, mannerisms, movement, hair, clothing styles, makeup, names, and pronouns. Pronouns are words we use to refer to someone without using their name. Examples are he, she, and they. It's important to use the pronouns a person uses or wants used by others to refer to them. Some individuals use neo or new pronouns such as Z, and others simply want their names always used rather than a pronoun that might assume or suggest a gender. We also have a name that we want people to call us, a preferred name. For many people, this is different from their legal name. Some people use a nickname, a middle name, or a completely different name. Nearly 500,000 veterans have listed a preferred name in their medical record since that option became available to them less than 2 years ago. Addressing or referring to individuals by the name and pronouns they use is respectful communication, and it's required in VA policy. I'm having difficulty. Thank you. I can see that slide. Everyone also has a sexual orientation. Sexual orientation is a person's emotional and sexual attraction to others. Examples of terms people use to describe their sexual orientation include straight, gay, lesbian, bisexual, queer, and asexual. Sexual behavior is about activities and practices. It's not always aligned with sexual orientation. For example, some men who identify as straight may engage with sexual behavior with other men. Additionally, sexual orientation and gender are not the same thing. They are distinctly different aspects of our unique and individual identities. Sexual orientation and gender are two of many social determinants of health or non-medical factors that influence health outcomes. Health disparities are preventable differences in disease, injury, violence, or opportunity to achieve optimal health. LGBTQ plus veterans experience higher rates of certain health disparities. Next slide. We should also consider the unique context of LGBTQ plus veterans' military experiences. The Department of Defense has a long history of excluding LGBTQ plus people from service. The bans on lesbian, gay, and bisexual service date back to 1942. Don't ask, don't tell policies eliminated enlistment questions about sexuality, allowing service members to serve in secret. However, even then, at least 14,000 service members were discharged for their sexual orientation. DoD has also historically excluded open transgender service. This history of discrimination explains the concerns LGBTQ plus veterans have in trusting VA and disclosing their identities to healthcare providers. Research shows LGBTQ plus veterans anticipate discrimination. We are working hard to change that perception. Next slide. And this is why LGBTQ plus veterans continue to experience stigma and discrimination. LGBTQ plus veterans LGBTQ plus veterans are 2 to 3 times more likely to engage in suicidal behavior, and transgender veterans are 20 times more likely to engage in suicidal behavior. LGBTQ plus veterans deserve appropriate and affirming care, and they've earned it. We want to make sure LGBTQ plus veterans know they're welcome and are expected at VA and with our community partners. Next slide. How are we doing this? VA has adopted 4 strategic approaches. We promote inclusive assessment of sexual orientation and sexual health by providers, and we educate veterans about the importance of adding their preferred name and gender identity to their medical records. VA has also begun to include the option for veterans to provide their sexual orientation and gender identity information in our patient satisfaction surveys. We also work toward continuous improvement of our national healthcare policies and educate VA staff through our online educational programs, virtually and in person through our LGBTQ plus veteran care coordinators, and we provide clinical support resources such as our internal SharePoint database. We inform and engage LGBTQ plus veterans and the community through outreach and increased awareness and visibility through welcoming signage, posters, fact sheets, videos, and awareness campaigns. Next slide. Our LGBTQ plus health program in VHA was established in 2012 following the repeal of Don't Ask, Don't Tell. And our program's mission is to facilitate policies, establish metrics, and develop clinical education to support this goal and to create a VA that all LGBTQ plus veterans will choose to receive affirming care and achieve optimal health and well-being. Our program manages 2 directives on healthcare for LGBTQ plus veterans, a transgender and gender diverse provider-to-provider e-consult service, a gender-affirming program for speech. We also oversee the LGBTQ plus health veteran care coordinator program, and we produce educational material and resources. Next slide, please. As I mentioned earlier, VA has separate policies from DoD. There has never been a Don't Ask, Don't Tell policy in VA. The first directive that LGBTQ plus health manages is VHA Directive 1340, provision of healthcare for veterans who identify as lesbian, gay, bisexual, or queer. This directive provides guidance to staff on provision of clinically appropriate, comprehensive, veteran-centric care with respect and dignity to LGBTQ plus veterans. The policy prohibits any attempts to change a veteran's sexual orientation and strongly encourages routine sexual health and sexual orientation assessment. Next slide. VHA Directive 1341, providing healthcare for transgender and intersex veterans, provides guidance and requires VA employees to create a welcoming environment and provide care based on gender rather than birth sex, ensuring veterans have access to room assignment and restrooms that aligns with their gender identity. This policy also includes details about gender-affirming medical care that is available through VA. And I do want to note that VA does not currently provide or fund gender-affirming surgery, but there is a process underway to remove this exclusion from the medical benefits package. Next slide. The LGBTQ plus health program also manages 2 national e-consult programs. The Transgender and Gender Diversity Consult program is intended to support local clinical services by providing non-urgent provider-to-provider consultation from an expert interdisciplinary team on transgender health. And they can any provider can contact these expert teams to ask questions and get subject matter expert consultation on any aspect of treatment planning. The Gender Affirming Program for Speech, or the GAPS program, was established to provide access to voice and communication treatment for rural transgender veterans. VA speech pathologists use telehealth technology to deliver this service directly to veterans in their homes, and this service can be accessed through interfacility consultation from any VA provider. Next slide. The LGBTQ plus Veteran Care Coordinator Program, or the VCC program as we call it, originated in 2016. VA realized the critical need for every healthcare system to have a designated point of contact because LGBTQ plus veterans are seen at every facility. The LGBTQ plus Veteran Care Coordinator Program ensures that every facility has at least one employee to serve as that point of contact for LGBTQ plus veterans, for VA staff, and for our community partners. There are currently 210 LGBTQ plus VCCs and 18 regional LGBTQ plus VISN leads nationwide. Next slide. A little more here about the work that VCCs do. VCCs work to support the implementation of the national policies I just mentioned at the facility level. They promote an affirming environment for LGBTQ plus veterans. They develop and provide tailored guidance and education to staff. They serve as veteran advocates. They identify the needs of local veterans and assist the medical facility in meeting those needs. They work on strategic planning with their facilities. They connect with external community organizations, such as some of you here on this call today. They stay connected about LGBTQ plus veteran care with facility stakeholders. VCCs also ensure the public knows about the local LGBTQ plus veteran care resources, and they participate in community events such as outreach activities like Transgender Day of Visibility, which is happening on the 31st of this month, and LGBTQ plus Pride events. Next slide. VCCs are here to assist, in summary, by connecting veterans with resources, by promoting that safe and welcoming environment, by developing ways to support veteran health, and by providing education and trainings to VA and to your teams in the community. VA employees can find the name and contact information for their local VCC in our directory on the LGBTQ plus Health SharePoint. Veterans and community members can find out who the LGBTQ plus Veteran Care Coordinator is at any VA facility on our publicly accessible website, and you can always email our program directly for assistance or support. Next slide. As I mentioned earlier, one simple way to create a welcoming environment for LGBTQ plus veterans is to use visible signs and symbols in which LGBTQ plus veterans can see themselves or identify allies in safe spaces. Here you can see examples of some of the signage from our program's awareness campaigns. Signs and symbols of recognition and visibility matter a great deal to veterans, particularly those who have experienced discrimination and rejection. Many of these are available to you on our public-facing website. Next slide. And this is a screenshot of our public-facing website and the many LGBTQ plus health resources that are publicly accessible to you. Next slide. And this is the contact information for VA's LGBTQ plus health program and for VHA's Chaplain service. And so I promised to make that short. So next slide. Now I am going to turn the mic back over to Ms. Pauling to introduce our exceptional expert panel of VA chaplains who are here with us today to discuss spirituality, religion, and health through an LGBTQ plus perspective.
Thank you, Ms. Brunson. We will now have a panel discussion with Ms. Brunson, Chaplain Robin Booth, Chaplain Constance Arthur, and Chaplain Butler Cole for 30 minutes, along with the Q&A afterwards. But before we do, I would like to provide a brief introduction. First, Chaplain Robin Booth is the Director of Clinical Pastoral Education within the VA North Texas healthcare system in Dallas, Texas. Next, we have Chaplain Constance Arthur. She is the clinical chaplain of Chaplain Service Mental Health Outpatient Clinic and LGBTQ plus Veteran Care Coordinator at the VA Medical Center in Dublin, Georgia. And lastly, we have Chaplain Butler Ben Cole. Chaplain Cole currently serves as the clinical chaplain of Palliative Care and Hospice Bereavement Chaplain and LGBTQ plus Veteran Care Coordinator at Lieutenant Colonel Luke Weathers Jr., VA Medical Center in Memphis, Tennessee. Now I will turn the mic back over to Ms. Brunson, who will be the moderator for this panel discussion. Ms. Brunson?
Thank you, Ms. Pauling. I'd like to invite the chaplains to come on camera. Thank you all for being here today. I want to start our panel discussion with a question about faith. Is faith important to the LGBTQ plus community?
I'll start with that question. Spirituality and faith is very important to many of us who are in the LGBTQ community. Many of us grew up in faith communities, and within these communities, we found a great deal of support and care. It was our foundation for our faith and our spirituality, and we have used that to really overcome some really difficult times in our lives. And so our spirituality is something that is very, very important. It's within these communities that we have had our spirits nurtured. We have made use of our gifts and our talents. And for many of us, our families were all part of the community. So family and church became kind of one unit of support and care and love. Constance, what would your answer be to this?
Yes, I agree. Faith is very important to our community. Having faith that the divine is next to you, accompanying you through life's struggles and trials is paramount for many of us. Without faith, one can often feel alone, isolated, and abandoned. And having faith gives folks spiritual strength, which helps them to overcome and address mental health issues like depression. Having faith fuels hope that one day a person will become a part of that beloved community. And faith is what allows us to live in the world the way the divine has made us, especially when we are alone. The primary value, of course, is love. And love can be expressed in ways that the divine leads us to love.
I absolutely would agree with Constance and Robin. I mean, it's absolutely important to us. My faith community of origin, it formed me growing up and really instilled several values in me that I've still hold today. Even though I don't belong to my faith of origin, I still hold on to some of the things that did work for me, and I've let go of some of the things that stopped working. You know, for example, community, discipline, helping others, that works. But the judgment and the hypocrisy, shaming others and forcing my beliefs on someone, that stopped working. My concepts of what I hold sacred, I mean, it just keeps evolving. It's an ongoing process. We all come from different cultures, creeds, and traditions, but we all have that common lived human experience. We all know intimately the things that we experience, such as grief and loss, shame, guilt, pain, rejection, suffering, and joy. Most of us have had experiences in life where we felt the sacred really close to us and it was clear. And other times in our lives, we end up finding ourselves asking, where is the sacred? Where is God?
Yeah, my response to all of our kind of um, talk is that the veterans that I see are making use of their spiritual resources. They are making use of their faith as they have to deal with issues that are of sickness and of death and dying and bereavement, of recovery. All of these aspects of our health require us to make use of our spiritual resources.
You know, research tells us that many LGBTQ plus people report experiencing spiritual trauma and rejection from their faith communities and religious organizations of origin. Can you tell me a little bit more about your experience as a chaplain and can you share how this impacts individuals who have had these experiences?
Yeah, my work with LGBTQ plus veterans always, I can almost say always, part of my care to them is dealing with the trauma and the rejection, the judgment that they have experienced from their faith community as well as society in general, the ways in which they've had to be secretive, and how suspicious they are of clergy persons in general. So one of the things that I think we have to do, certainly as clergy persons and as chaplains within the VA, is help them to recognize that that we are going to be accepting and caring of them, that we're not going to promote messages in which they may have heard in the past of being demonized due to who they are as a person or who they love. We want to emphasize that they were divinely created in the image of God, and that their sexual orientation, their gender identity is compatible with their faith. Some of us have struggled with the incongruency of what our faith says and what our lived experience is. We hear different messages from faith communities, one that God is love and caring and desires to be with us, and the other is that God hates us and judges us and sees us as an abomination. Well, these teachings all have a major impact on how we see the world, as well as how we cope with life in general. So as we work with veterans, I always have to be sensitive to that type of trauma that they may be experiencing, and helping them to also recognize that I'm a safe person in which they can talk about all of their issues and problems. Constance, how would you respond?
Yeah, I think that sometimes when folks experience rejection and trauma, the impact of that is they will look for spiritual food in other spiritual places. We walk away from our churches of origin. And this opens folks up to looking for the divine outside of their faith community. This can mean learning about other denominations, religious traditions, as well as community organizations. When we have experience with other faith-based organizations, we learn that we share many of the same values, such as kindness and compassion, respect for others' life journeys, and the internal need that we all have for community. In that search for individual acceptance and inner peace, we create unity with those we encounter along the way, which leads us towards peace. We all become committed to the health and welfare of that beloved community. Personally, I did not experience rejection during those growing up years. It came to me after seminary when it was time to be employed. And that is when I experienced the rejection. Also, that intersectionality of rejection also became evident. That intersectionality between our religion, sexuality, as well as race. Butler, how does that affect for you?
Well, I think it's interesting you both, Chaplain Constance, Chaplain Booth, hit on rejection and abandonment. I heard a trauma therapist say one time that out of all the possible forms of natural disasters, of trauma, violence, any kind of MST, sexual trauma, abuse, out of all of them, the two most lethal, based on research and evidence-based practices, are rejection and abandonment. And that is definitely something that this community experiences and has for a long time and still is. You know, as you both kind of said, that many of our veterans have spiritual angst about how their personhood as an LGBT person can coexist with their spirituality. We're taught in church growing up, and even in our culture, you know, that things are black or white. They're either or. They're us versus them. But we chaplains get this awesome opportunity to ask questions, to help show them exploration, that there may be a gray area. There could be a both and explore a sense of community that forsakes this us versus them concept for something more in depth, more sacred. And so many of us feel shame and guilt about being LGBT persons. We're told we don't belong, and thinking that the only way we can live in this world is to be celibate and deny our authentic selves, which I can attest to is miserable and possibly very dangerous. As Dana mentioned, you know, our population is 3 times more at risk for a variety of things like substance abuse, isolation, suicidal behavior, obesity. You know, many in the community too have also experienced emotional, physical, or sexual trauma in the military or in the churches which they grew up in, and that really distorts their concept of what they hold sacred. And terms that we use, especially a lot in the South, like God as Father or Mother, can be very harmful. And so we have to help them kind of deconstruct their faith and theology and reconstruct as best we can and support them in that process.
And so in that reconstruction process, in that support you provide, what spiritual needs do LGBTQ plus veterans identify, and how have you been addressing them as chaplains?
Well, as I said earlier, oftentimes folks in our community, veterans, who have experienced rejection and trauma in their past, may be very suspicious of a clergy person coming to them. And so we really have to create a safe space, an accepting space in which they can share their story, in which they can share the trauma that they experienced, in which they can start to talk about what is happening with them right in the moment, and to be able to make use of the spiritual resources, some of which they may draw from that faith foundation that they had early on. You know, we have to affirm and recognize that they more than likely have experienced some of this trauma. And so we need to be able to affirm that, yeah, this has been a really, really challenging time for you. And that there may be shame that comes along with that. You know, many folks were rejected not only by their faith communities, but they were also rejected by their families and families of origin. Depending on what time they came out in their own life, you know, they may have been rejected not only by their siblings and their parents, but by their children as well. So we have to keep that in mind. That's some of the needs that they have. We have to recognize, as we do with everybody, not just the LGBTQ community, that their questions are important, and their struggle, their spiritual struggle that they may be facing right then and there is important to them, and that they are striving to make use of their faith to address these issues. Um, and Also, we need to recognize that the coming out process, or what I like to use as the coming into process, into their sexuality, is individual and is unique for each and every person as they kind of come out and move into who they are as a person of God and a person of faith.
Yes, I agree with that, Robin. I think that when we start talking about spiritual needs, it's important for us to realize what some of those spiritual needs are. And some of them are to experience love, such as agape, eros, philius, and storge, and forgiveness, reconciliation, spiritual healing, and what it's like to experience being in a community. These are some of the spiritual needs that our veterans express and show us. The veterans that I work with are given the opportunity to both feel, doubt, question, and wrestle with their faith and what it means to be human. I guess one of the primary ways to address all of that is to realize that feelings are often the front door to your spiritual self. And we are made up of mind, body, spirit, and emotions. These are our strengths. And all assist us in our experiencing of the divine, as well as the beloved community. Talking about these issues is how we address our spiritual needs for our veterans.
I agree. And I think, kind of to echo what you both just said, you know, we're as chaplains providing spaces to go to the dark places with our veterans. They're desperately longing to connect with somebody, anybody that will sit with them in those dark spaces and those places where your faith crumbles and renews and restores and questions. You know, I also think in order to answer this, we have to clear up the myth of what we chaplains do. Many think that we simply go around and pray for people, and that's all we do. And we do that, but we do so much more than that. In meeting our veterans where they are, we facilitate questions and storytelling to help them explore core concepts of their spirituality and humanity with things like meaning making, suffering, finding purpose, their identity, their values, their losses, their shame, forgiveness, sense of belonging, or my favorite, lamenting, which I translate as divine complaining. You know, sometimes we just need to be able to lament and say, this is hard. Life is really hard. For me, I hope each day and pray that my concept of what I hold sacred, you know, if it looks like this today, that it gets shattered today and expanded and shattered and expanded just over and over again, you know, and sitting with the veterans, I I think a lot, and I think Chaplain Booth and Constance would agree, we give veterans permission a lot. Permission to be themselves, to question, to doubt, to name their pain, name what they're feeling, and explore what they hold sacred. And one of my favorite preachers said, holiness is simply paying attention. And that's what we chaplains do. We pay attention and we facilitate storytelling to identify those spiritual wounds and the roots of what is really going on within a person's spirit and soul. One of my favorite theologians, Peter Rollins, he talks about how we're all haunted houses walking around and we're full of ghosts. And the more we run from those ghosts, the bigger those ghosts become, so big that they can turn into poltergeist if we let them. But we as chaplains, if we can help our veterans find a flashlight, stick some batteries in it, turn it on, and shed some light on those ghosts and expose them for what they are, then transformation can occur, making a Holy Ghost, and healing and meaning and purpose can just be birthed into their lived experience. And it's such an honor and privilege to witness that in our veterans, for sure.
It's a real gift for us to be able to enter into those spaces with the LGBTQ plus community, but other veterans as well.
And so you've talked about some of the things that you're doing. Can you tell us why you think it's so important and beneficial to faith organizations to welcome and affirm LGBTQ plus people?
Well, the simplest answer to that question is because it's the right thing to do. Okay. We are a community of individuals who are certainly looking for a place for support and care. And much like the teachings of most faith groups, is to always welcome the stranger. And many of us are probably not strangers because you would know us, but we are the ones that kind of been pushed out. And so welcoming us in would be important. And to remember that we are made in the image of God and that God has created us different than other folks, but nonetheless created us, and we are all created differently. So that's the other aspect of it. You know, our community, the LGBTQ community, represents lots of differences even within that community. I think the other aspect of that is we have a lot of gifts that we can offer and give to the church. We want to use those gifts. We will find ways in which to use those gifts if it's not in faith communities. We will go out to other organizations and use our gifts. And so those are some of the things that would be important for the faith communities to remember.
Chaplain Constance, I think you might be muted.
Yes, I think that one of the things that is important with welcoming LGBTQ individuals into faith-based communities is hospitality. Hospitality is a value, and LGBTQ plus individuals have a story to share of their faith journey with these faith-based communities. And when we hear how the divine has worked in the life of one who has experienced alienation, we can become inspired with the graciousness of the divine, which brings us even closer We hear them speak on the values that they have been living with. And we learn how those values can be the same as ours, or we learn that we too want to adopt those values, such as kindness and hospitality, stewardship of the earth, as well as generosity. Sorry, my computer, oops. They can share how the divine showed up in their life, offering love and support. And we can become aware of our interconnectedness when they are in your spaces. And those spaces can become our spaces. And we open ourselves to the opportunity to bring forth a beloved community within those spaces. And that becomes, for all of us, a place of love, a place of understanding, a place of respect and appreciation for the unity that can be created when LGBTQ individuals are welcomed and experience hospitality into faith-based communities.
Yeah, I think we've done a good job acknowledging that many in this population are harmed by faith communities, but it's not always just for their sexuality or gender. It can also just be for being different, and that's that plus in the LGBTQ plus, and for asking questions. For example, when I was 12 years old in Sunday school, I had a basketball coach mentor in my life, take her own life, and I sat in Sunday school class with her niece, who I'm still friends with today, and heard the Sunday school teacher say that that person that we loved so dearly was burning in hell. And it took a lifetime to grieve that. It took 20 years to even really expose it and to acknowledge that that happened. And as we previously mentioned, so many say that the community needs to burn in hell, or that we don't have value. And this leaves so many of us in the community and our veterans thinking that, God can't use them, who God created, and that just wrecks their faith. It wrecks our faith. And I even used to preach some of that toxic theology when I was younger. And I know that as a representative of the church myself, and I believe that all faith-based communities need to deeply apologize and make amends and say, we are deeply sorry. And we're going to have to find new ways to build that trust again and reconcile this great tragedy on this beautiful community. And we need not just invite or welcome LGBTQ plus persons into our faith communities. We need to tell them with gusto that they belong and are to be celebrated. And this ultimately will create more safe spaces, which can save lives.
We have time for just one final question for all of you before we answer questions from the audience. I'd like to ask if you could offer one piece of very practical advice to faith-based organizations and our VA neighborhood partners to help them to create that safe spiritual space, that environment that affirms and supports LGBTQ plus veterans, their families, and the community at large. What would that one piece of advice be? What would that one practical tool be?
So my one piece of advice for faith communities, and this would be for faith communities of all types, is to recognize that we are wonderfully created in the image of the divine, and that to recognize that and to celebrate that would be wonderful.
As Dana mentioned earlier in the presentation, we all have these things: sexual orientation, pronouns, gender, and preferred names. Not just LGBT people; it's everybody. And so, when we do this simple act of saying someone's preferred name and pronouns, and acknowledge them for who they are. It is holy, it's magical and mystical, and it creates mutual respect that shows that, you know, another world's not only possible, but it's already here. And what lacks is awareness of it, and we need to affirm it. You know, RuPaul said we're all born naked and the rest is drag. And I love that. And it's what makes us different, unique, and similar all at once. And lastly, you know, many hear about the statistic of 22 veterans a day taking their own life, but not many know that 67% of that 22 are LGBTQ plus veterans. So affirming and celebrating this community and who they are is holy work, period. Anything else is blasphemous, to be honest.
Yeah, I agree with that 100%. I think there's a couple of ways that we can certainly provide a safe spiritual environment for folks. And that's by having an awareness and acceptance of the various ways that people come into the world. That goes back to our slides. We showed examples of that. There's a plus sign behind the various ways in which people come into the world. And we need to be able to, our faith communities need to be able to affirm that. Also, you can provide a safe spiritual environment by accepting and being open to the gifts and the experiences of others. When they tell those stories, we want to listen, and we want to be able to take them and apply them to the situation that we find ourselves in our faith-based communities. Also, the safe environment will enable all to share values and create an ethical foundation that reflects the vision of a culture that enables all the creatures of the divine to live in harmony with one another.
Chaplains, thank you all for sharing your insights, for sharing your experiences. And I think we are going to move into the final portion of our call today. And I'm going to turn the mic back over to Ms. Pauling, to moderate questions from the audience.
Thank you, Ms. Brunson, Chaplain Booth, Chaplain Cole, and Chaplain Arthur for that discussion. We will now address any questions in the Q&A box. We have about 2 questions. I think we can get around to these 2 questions today. The first question comes from Stuart Hong. Could you please explain on how chaplains facilitate, pardon me. Could you please explain on how chaplains facilitate meaning making, especially thorough storytelling? And that question came from Mr. Stuart Hong. To any of you.
Constance, do you want to jump in there?
Sure, I can jump in there. One of the ways that we facilitate meaning making through storytelling is in some of the groups that I do. I have mental health and spirituality groups here at the VA, and they're with veterans with PTSD, veterans with moral injury, veterans with MST, and I have a group for grief and loss. And giving veterans the opportunity and the space to tell their stories is one of the main things that our groups do for veterans. Is they get an opportunity to share their thoughts, to discuss their theology, and to help it to expand. And with all of that, they can make meaning of life and themselves in the cultures that we live in currently. And I find it a blessing to hear their stories and to see their change and to see how they're able to utilize their spirituality, not just for themselves, but also for their families.
Okay, thank you very much,
Oh,
Chaplain Arthur. We have about 2 minutes.
I was just going to add, you know, two of the rituals we do that I've done with veterans here in our PTSD group historically was they do their inpatient 8-week course class, and at the end, because we have so many combat veterans, we bless their hands because of what they've experienced while at war and in combat. They feel like their hands are no longer worthy to be here and to do things that are divine. And so we bless their hands, and it's very, very meaningful. We also explore the meaning of their actual names. Some people don't even know, the origin of their names and where they came from. And that's another place where we try to kind of enhance their identity and know where they came from.
Okay, thank you very much. We have more questions. We will provide those questions to you, Ms. Brunson, to provide a response. We have about 1 minute. If at the end of Mr. Washington's closing remarks, if we have some time, I don't think we do, we will try to get to one of those questions. Mr. Washington, are you available to provide closing remarks?
I am. Hey, I just want to say thank Dana and all the chaplains today. I really appreciate it. And I tell you, I wish we had more time to unpack this. There's a lot there. I know that. I have a lot of thoughts, as many of you do. And again, I appreciate all of you joining us, and I hope that it was very beneficial to you. And just know, as I keep reiterating, the VA is here for everyone, right? We love everyone, and we want to provide as many resources as we can to each of you. And as a faith leader myself, part of my response to some of these issues is that we are all loved. And if you think that's not true, for me, the Bible is my way of trying to navigate. And I would say if you look at the disciples, they were not great. They had issues, but they were still used. So I'll leave it at that. Thank you again for joining us. And please know that we have these webinars each month, and we look forward to y'all joining us. So be blessed, and thank you for joining us.
If you need to reach out to any of the presenters or any of our team members or our office, our point of contact information is on the screen. Feel free to do so. We will provide the questions to Ms. Brunson for the ones that we didn't get around to today, to provide a response back to you right away. If you registered for this event, we will provide you with Ms. Brunson's presentation. A recording of this webinar will be provided on our website at a later date. Please subscribe to our website and Facebook for future webinars and information. This adjourns today's webinar. Thank you for joining us today, and have a safe and wonderful day. Goodbye.